So here's the thing. If you are looking for a diagnosis of ADHD, you're going to get it. If you're looking for diagnosis of anxiety, you're going to get it. If you are looking for a diagnosis of depression, you're going to get it. And if you're looking for medication to treat ADHD, you're going to get a prescription. If you're looking for medication to treat anxiety or depression, you're also going to get a prescription for that. But here's the thing that you really need to know about these three different illnesses is that all of them affect your executive function. And executive function is the one that allows you to carry out your goals, to carry out your responsibilities, to take care of yourself on a day-to-day basis. So if you're coming to the doctor with a symptom of inattention, you're unable to sustain your attention for perhaps 20 minutes, which is what you used to do, but now you can't even go 5 minutes. That symptom of inattention is there in ADHD, it's there in anxiety, it's there in depression. If your symptom is that you can't concentrate, it's there in depression, it's there in anxiety, it's there in ADHD. If your symptom is forgetting things, it's there in depression, in anxiety, in ADHD. If your symptom is initiating tasks, you're having a problem with motivation, you don't feel motivated anymore to do things, that symptom is there in ADHD, it's there in anxiety, it's there in depression. If the symptom is procrastination, you start tasks but you're unable to finish, that symptom is there in anxiety, in ADHD, and in depression. If your symptom is that you're finding it difficult to control your impulses, especially in pleasure-seeking behaviors, like watching TikTok for long hours, that symptom is there in anxiety, it's there in ADHD, it's there in depression. If you're having problems organizing your day, organizing your room, if you're having problems committing to the goals that you probably set, or prioritizing things, that symptom is also there in ADHD, in anxiety, and in depression. And so these three illnesses tend to have overlapping symptoms that are very similar to each other. And it's very important to go through a careful assessment for you to get the right diagnosis. So if you're going to the doctor with the attitude and a mindset that you want to know what's wrong with you and not validate what you've Googled on the internet, then you're probably going to get an accurate diagnosis, the right diagnosis. Because a lot of people are being put on ADHD medication, are insisting on being put on ADHD medication when they don't have ADHD. Trauma can also look like ADHD. And so instead of coming to validate what you read on the internet, what a lot of people are saying about their symptoms which feel similar to you, go to the doctor with the attitude that you want to understand what is wrong with you. You want to understand what your lack of motivation is a symptom of, what your inability to concentrate or to focus is a symptom of. You want to know where your planning is not working the way you want it to work, where your life is not where you want it to be, where you're not able to achieve the goals that you're setting for yourself. But avoid going to the doctor to validate what you read on the internet.